morning. My name is Ray. I'm a level one nursing student. Do you mind if I shadow you today?
Sure, go ahead.
Alright, I have a couple of questions for you. Can you give me an SBOW on the patient that we're about to see?
Yes, this is Mr. Levi. He's in room 620. He's a 67-year-old male. Full code. He has a couple allergies. We do have a tetracycline, peanut, and dog hair allergy for him. He came in, he is a stage 2 diabetic. He was diagnosed 20 years ago and he is fully insulin dependent. And he also has a stage 2 diabetic ulcer on the right heel that has not healed for he noticed that 3 weeks ago. He has also, for the past 5 days, had an increased blood glucose level in the 300s consistently, where he's normally in the 120s. And he did have an A1C test on him 3 months ago that turned up to 8.2%, which is a little high as well.
Is the client on any medications?
Yes, today we're going to go ahead and give him lisinopril, vancomycin, and insulin.
Why specifically is the client receiving these medications?
The insulin is for his blood glucose. That's to keep his levels down. The lisinopril is for his elevated blood pressure. And the vancomycin, because he has an ulcer, we're going to go ahead and give him an antibiotic just for a preemptive measure.
And what are the actions of these medications on the body?
Yeah, so for the vancomycin, that's going to attach to the bacterial cell wall, killing the bacteria. The insulin, it slows down or stops the liver production of the glucose. It also helps the skeletal and fat muscle cells go ahead and absorb the glucose that's in the blood already. And the lisinopril will go ahead and stop angiotensin 1 from turning into angiotensin 2, which is a vasoconstrictor.
All right. When should you question administering these medications?
You should question probably the insulin if you take a blood glucose for them and it turns out pretty low or normal. If we go ahead and give him insulin, then we could have some hypoglycemia, and we don't want to do that. For the lisinopril, the same thing, just with blood pressure. If it's too low, we don't want to give him more of the lisinopril if he does have lower blood pressure. And the vancomycin, not really anything.
Which vital signs should be monitored before giving these medications?
The blood pressure should be monitored for the lisinopril. And for the vancomycin, we do want to take a look at the temperature from time to time, because if he does have a temperature while he's on vancomycin, that might indicate a pretty serious infection.
Okay. And which physiological parameters should be monitored when the medication is being administered?
For the lisinopril, we do want to watch out for the angioedema. That is swelling in the face. And we also want to look for the hypotension. They could be dizzy, have a headache. For the vancomycin, we want to look for anaphylaxis. For that, it'll probably be some sort of rash, possibly on the palms or anything. And then for the insulin, we're looking for hypoglycemia, which they could have tingling in the hands, but that's the main thing that we're looking for there.
All right, what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
The biggest one is probably the insulin. We want to go ahead and rotate that injection site. If you stay on one site, such as the abdomen, for too long, you could have lipodystrophy that could affect the absorption of the insulin. The vancomycin and the lisinopril, again, we're just looking at the blood pressure. And for the vancomycin, we do want to make sure that the IV is good, intact, and in the right spot. If it gets infiltrated, then that could cause some problems for the patient as well.
All right. And what interventions must be taught to the patient when taking the medication home safely?
At home, again, with the insulin, you want to rotate that injection site. And then the lisinopril, we do want to go ahead and tell them that they might want to check out their blood pressure before taking it every day. Yeah.
All right. And what are the side effects and potential adverse reactions of these medications?
The side effects, again, with the lisinopril is the angioedema and the hypertension. For the insulin is the hypoglycemia, and then for the vancomycin, we do want to look for the anaphylaxis or the rashes.
And how would you know the medication is effective?
For the vancomycin, any absence of an infection, we know it's working. For the insulin, if his blood sugar is controlled, that's pretty effective when we see that. And then for the lisinopril, if his blood pressure is controlled.
All right. I have no further questions right now. Do you mind if I watch you do your medication administration?
Sure, go ahead. All right. Hello, Mr. Levi. We're going to go ahead and give you some medications. My name is Chris, and this is Saray. She's a nursing student. She's just going to go ahead and watch. So the first thing we're going to go ahead and do, go ahead and wash our hands when we come into the room. Don't bring anything out from the outside. All right, and now we want to go ahead and take the ID of the patient. Mr. Levi, can you go ahead and tell me your name and date of birth?
My name is Levi Restivo, and I'm 67 years old.
Thank you. And do you have any allergies?
Yes, I'm allergic to tetracycline, dog hair, and peanuts.
All right, so we go ahead and check the band for that. We can also check for the allergies on the chart as well. His full name and date of birth are on here also. So now that we have that, I'm going to go ahead and go through the physician orders and make sure they match up with the MAR. So it says here we got the sliding scale for the insulin, so we do have that. And down here we do have the vancomycin ordered for 1.5 grams of IV, and that's per the pharmacy dosing. And then we do have the lisinopril, 10 milligrams by mouth daily. You do want to go ahead and make sure that you have all the dates, the times, the routes, what dose they're getting, the right patient. You want to go ahead and verify all of that before you give them anything. So now that we go ahead and have the physician orders, we go ahead and look at the MAR and make sure everything matches up. Okay, so we do have the lisinopril tablet. It is on Tuesday, 1700, 10 milligrams oral once. That's good. That matches up with the physician orders. We do have the vancomycin here, 1700, 1.5 grams or 1500 milligrams IV piggy bag once. Matches up with the physician orders. And then we do have the insulin regular, which if we slide over it, it does come up with that same sliding scale as the physician ordered. So we are looking good. Okay, so the first thing I'm going to go ahead and give is the vancomycin.
Mm-hmm.
And whenever dealing with the patient, I like to put on gloves, even if you're not dealing with any sort of bodily fluids. Okay, so per the pharmacy protocol that's listed on there, we are going to go ahead and give this with some normal saline. So that's the first thing we're going to go ahead and hang for this patient. And what we're doing here, we're just making sure that this all matches up with what is given. We do have a 500 milliliter bag here with the vancomycin. We're going to go ahead and give them that. Yeah, the first thing I'm going to do actually is going to go ahead and prime the tubing. With this, we want to go ahead and make sure that these areas are kept sterile. This is normally not open, but let's see here. Student nurse, would you like to help with this bag?
Yep,
please?
absolutely.
That golf tee is pretty far in there.
Yeah, it's in there pretty good.
Get another one.
I can run down to the med room and get another bag if you'd like.
Yes, please, nurse. That would be excellent.
I got one fresh from the pharmacy for you.
Thank you, I appreciate it. It's all about teamwork in the nursing world. Alright, so now we are going to go ahead and prime the tubing. Then, like I said, we're going to go ahead and keep this and this sterile for this procedure here. Let's go ahead. This tubing is pretty long here. It's a lot to manage. So we do have to check if all the clamps are open. If the clamps are closed, nothing's gonna happen. And it is moving, it's just moving very, very slowly. Alright, so we can go ahead and clamp this now. So now our primary tubing is primed. And we're going to go ahead and hang it from here. And for this patient, we are going to go ahead and use a dial-a-flow. Now with the dial-a-flow, with anything for IV tubing, we want to go ahead and use alcohol pad before we put any tubing inside any hubs, anything like that. We do want to make sure that everything is kept clean as to avoid infection. And now the dial-a-flow is connected. We are going to go ahead and connect it to the patient. And for this, we're going to go ahead and flush as well. So new alcohol pad every time here. Scrubbing, scrubbing. And we do want to insert some, pull back, aspirate some, make sure we see some blood there, and then go ahead and keep pushing. Now with this flush, if you do have any sort of resistance, that is indicated that it is blocked, but this one does look good. So we're gonna go ahead and connect. And now we're going to go ahead and move on to the second, which is the actual vancomycin. Now, Mr. Levi, do you have any questions regarding the vancomycin? Do you know what this is for?
I'm really not sure what this is.
Okay, so we do have a couple of pamphlets here for you. on the vancomycin, the lisinopril, and for the insulin. If you do have any questions, I'm going to go ahead and ask you some questions about it later, but we do have some highlighted portions here for you just for safekeeping and for your reading pleasure.
Okay, thank you.
So now we are going to go ahead and do the vancomycin. Again, you want to go ahead and check the MAR and the physician orders before you pull and before you go ahead and administer to the patient. So here, check the provider chart. We're going to go through the MAR. We're going to go ahead and make sure all those match up. And then we're going to go ahead and pull open for the vancomycin injection. All right, so it looks like here we have the 1,500 milligrams IV piggyback at 1,700 on Tuesday. All this does match up. And here, since we have ID'd the patient, made sure we have any unknown allergies, and we checked his date of birth and everything, we're going to go ahead and plug in all this information here. So we do have this information, 60 and 67. 456. And now we go ahead and do the vancomycin. And as you see here, we do have the green verified light. This is the safety precautions that every hospital now has just to avoid any sort of medication errors. So now we will go ahead and set this up for Mr. Levi. So before we go ahead and connect that, we do have the prime again. With this, we do have to be careful because we do have a limited amount of this medication and we don't want to waste too much of it. So we're going to go ahead and prime this slowly here. All right, we do have that primed. While we're doing this, we're going to go ahead and check to make sure there are no air bubbles in here. And it looks like we are good. Once again, we are going to go ahead and scrub the hub, if you will. All right. And now we did go ahead and check the rate before this, and we do have it at 125 milliliters an hour. So I'm going to go ahead and set the dialiflow as such. And we do have the 125 milliliters an hour on the dialiflow here going. And then you do want to make sure that you have a couple drops go down before, just to make sure that everything is running. Make sure all your clamps are unclamped. And we do have drops going here, as you do see. So we have we want to wait for a few drops, and then we're going to go ahead and move on. All right, so now we have given our patient vancomycin. We're going to go ahead and record all that we have done with him for this medication. For 1700, the time is now 1650. And for the vancomycin, we did go ahead and give that in the IV in his right forearm. And we always want to go ahead and make sure we give at what site we give it at. Initial, and that medication has been administered. Now we're going to go ahead and move over to the insulin. One thing that we do want to go ahead and check is his blood glucose level right before we do this. So we do go ahead and check. And the last time I checked, let's see. So we do have 290. So when we go back to the MAR, once again, we have checked our physician orders and made sure they match up with the MAR. And if we scroll over this, we do have 241 to 300. We're giving 16 units of regular insulin as a sub-Q injection. Again, putting on gloves as to avoid contamination to ourselves. So over here we have pulled it up after we checked. And we are going to go ahead and check it once more before we give it. So we're going to go over here, make sure that this is regular insulin. We're giving the regular insulin, and we are on the sliding scale. All right, and we're drawing up 16 units according to his blood glucose level. Before doing this, we do want to go ahead and scrub the top with an alcohol pad. And we want to be very careful as to not stick ourselves. All right. And we do want to have somebody verify this. And would you mind verifying that there is 16 units as prescribed for the patient?
Yes, it's 16 units.
16, thank you very much. And since this is a subcutaneous injection, we are going to go ahead and give this in the abdomen for Mr. Levi at this time. And just as you are pulling it out, we are going to go ahead and use another alcohol pad for the patient as well. So leave it in there for 1 second. And we're not going to recap this needle. We are simply going to go ahead and place it in the sharps container as to avoid sticking ourselves. And Mr. Levi, Ask him if he's in any type of discomfort. If he's not, that is fantastic.
Nope, all good.
Thank you, Mr. Levi. Now we're going to go ahead and document that we have given Mr. Levi his injection. And this we have previously scanned when we were doing this, as well as we do already have the patient ID before we give this medication. And once again, when we do have this up, this appeared to have closed out, but we do have this. We verify this before we give anybody their actual injections to make sure that we do have the correct patient and the correct dosage and medication. So here we do have the green verified light on here, and we're going to go ahead and give us the time, which is 16:55 here. And we're going to go ahead and document that this was given in patient's lower left abdomen. And we're going to go ahead and initial. And we have finished documentation of that. Now we're moving on to the lisinopril tablet. For Mr. Levi, once again, we're going to go ahead and verify everything for him. And we have verified that this is, in fact, the lisinopril at 10 milligrams given orally once here daily. And we have verified that this is the correct medication and the correct patient. When we're doing this, we do want to go ahead and check with the pharmacy about these dosages and make sure that they are safe for patients. We also do want to go ahead and check if we have to crush, split, or anything else with this medication. For lisinopril, we have looked up. This does not need to be crushed. This can simply be given to the patient and be taken orally. So we go ahead and give this in the cup. We have some water for the patient. Here you go, Mr. Levi. Enjoy your meal.
Tastes good.
We've given that in a 16:56 is the time. And we do want to go ahead and note the blood pressure for this. We have checked that, and it was at 132/70. And we sign with the initials. And that medication administration has also successfully been completed. Now, Mr. Levi, I do want to go ahead and ask you about those side effects that we are looking for with these medications. Are you up for the challenge?
Yes, I am.
All right, Mr. Levi, what are we looking for with lisinopril?
So with lisinopril, I'm going to make sure my blood pressure doesn't drop too low.
Right. Very good, very good. And for the vancomycin, is there any sort of side effects or anything that we're looking at when giving that?
Anaphylaxis.
And how does that precipitate?
I'm gonna feel dizzy. I might have an allergic reaction to it.
All right, very good, very good. And what about the insulin?
I'm gonna make sure that I don't go into hypoglycemia, indicating too much of a low blood sugar.
Excellent, excellent. Very good, Mr. Levi. You are now an expert. And I'm going to go ahead and wash my hands before leaving. And Mr. Levi, do you need anything for right now?
Nope, I'll be good.
All right. And you have a good day, Mr. Levi.
Thank you, you too.
Alright, I still have a couple of questions for you.
Okay, go ahead.
Alright. Were there any pertinent pieces of information you reviewed before administering the medications?
Yes, for the lisinopril, we are checking the blood pressure. And then for the insulin, we are checking the blood glucose.
Okay. Did this information affect your decision to administer the medication?
Yes. If he did have any sort of low blood sugar or blood pressure, we would go ahead and withhold that medication.
Did the information affect how you administered the medication?
How it's administered, we do have the sliding scale for the insulin. So if it is, if the blood sugar is too low, then we go ahead and withhold that. And the same thing with the blood pressure. If it's too low, we withhold that as well.
Thank you so much for letting me follow you.
Absolutely.
I really learned a lot from
You have a good
today.
day, Saray, and good luck in nursing school.
Thank you. I need that.